in which the foreign-born population is working side by side with the native-born in all sectors of the economy in Virginia, and they're bringing complementary skills that help strengthen the whole sector.
Okay, before we go to this side for a question here, Edgar, we have the translating equipment now? Okay, so we have the translating devices available, so if you want to calmly make your way over, anybody needs it. Tenemos ya finalmente los aparatos para traducir, así que si necesita un aparato de traducción, por favor, levante la mano para que Edgar les pueda traer uno. Okay, so let's go, alright, so we're going to, is there a question on this side? We're going to go question this side and then we'll go back to this side. If not, let's go ahead. Let's go ahead. Go with your question, your name, and where you're from, please.
Hi, I'm Nash Fayad, Richmond, Virginia. I'm representing Fayad Law Immigration Attorneys and also the Legislative Committee Chair for the Virginia Asian Chamber of Commerce. Very quick, 2-3 questions. The first is, are there any already upcoming laws that put before the General Assembly for this session, specific ones already? And do you have them listed anywhere? I don't want to take your time now. And any recommendations and on who are probably the most influential for this session, who to target for organizations starting now and going and talking to down in Richmond or in other counties that will be maybe bring in some negative bills or help them to put some positive bills there?
First, the question was, are there bills that have already been introduced? No, because we're in the middle of an election and everybody in the House of Delegates is running, and we're sort of guessing what's going to happen in part based on what they're running on. And so, to the extent that people aren't sort of talking about introducing a lot of anti-immigrant legislation like they did in the 2007 campaign, we're thinking that it's kind of falling back on the curve of whether people are going to be pushing that. The pre-filing dates for legislation isn't until after the election, so you'll start to see bills being pre-filed in November, and we'll have a better sense and start tracking things on richmondsunlight.com and other places where we put those lists of bills that we're following up. But and then the question of targeting again is there's going to be some shakeup in leadership because 2 very senior people in the House Republican caucus got defeated in primaries, and whenever that happens, it changes the circles of influence, and it changes who's done. Like Beverly Sherwood was the public safety chair of the Appropriations Committee, and so if we wanted to be influencing policy on the budget as it applied to law enforcement, we'd be trying to talk to her, but she's not going to be there, and we don't know who that person's going to be yet. And she also played a role in militia and police, and so her coming out of the mix is going to change some of the circles of influence that are important. There are positions that are always critical, but what I say to everybody is the most important person for you is your delegate and your senator. Because when we go down to lobby, I always talk about a big sort of pyramid. And there's a foundational base, which is the kind of work that Michael does that helps educate the public about the truth of what our state is like and how we're different from other states. There's a middle element, which is electioneering and engaging with people in the elections process and in voting. And then the very top of the peak is this lobbying in Richmond. But you can't really do anything with that unless you've done the other parts. And a key element of being successful at the top of the pyramid is relationships. So I always say the most important thing for you to do now, not when the General Assembly's in session, now and ongoing, is to know who your House of Delegates member is and know who your senator is, and to make sure they know who you are, so that you're there with them, all year round. You're seeing them at places, you're reintroducing yourself, you're saying that these issues matter to you, because it really is about building those relationships, and every one of them is a relationship and development, even if they've been as hostile as you can imagine.
And if you have that relationship before the General Assembly session, then if you come on down to Richmond for the Day for All People, I guess, the lobby day that's hosted by the Virginia Interfaith Center for Public Policy, Vakalau, a bunch of other groups, they will know you already, and you'll be able to pick up your conversation where you left off. But definitely your own local delegate and your own local state senator are who you want to be talking to in advance of the session.
Thank you. Unfortunately, as you know, we will have a multiple questions that probably would be asked and will be appropriate because of the importance of the subjects. Unfortunately, we've come to the conclusion of the segment we had for this particular panel. Before we give them a warm hand, let me repeat who they were. They were Executive Director of the American Civil Liberties Union of Virginia, Claire Castañaga. They were Legal Director of the Legal Aid Justice Center and Immigrant Advocates Program, Tim Freilich, and the President and CEO of the Commonwealth Institute for Fiscal Analysis, Michael Cassidy. Let's give this panel a warm and excellent. The good thing also is that I'm sure that some of them will be hanging around for the remainder of the day or as much as possible, and they may be available to approach them individually, ask them further questions. So I'm sure they'll be happy to engage you during the as time will allow. Let me also then ask, as we turn over to our next part of the agenda, hopefully everyone has a copy of the agenda. If you didn't, please make sure to grab one. I know I got to get a packet myself with those statistics that Michael read because there's a lot of important information. Hopefully that's in the packet. I'd like to call up here then Alice Foltz, President of Centerville Immigration Forum. Come on up, Alice.
Hello, I'm here for just a few minutes to help us move and stretch a little bit. I'm Alice Foltz, as Walter said, representing Centerville Immigration Forum. I'm the chairman of the board. We were founded officially in 2010 to stop the voices of fear and anger in our little part of Fairfax County and build a welcoming community, and we're still doing that. But this is going to be a stretch time. So, first of all, I'd like to ask everybody to stand up. Please stand up. And if anybody needs translating equipment, this is a good time to get connected with that. Okay. Would everybody reach up high, stretch up high, and think about all the dreams and hopes we have for immigrants and for building a great community where we are. Yay! Okay. And then I'd like you to turn around and say hello to at least 3 people and get their names. out in the hall. Okay. But I'd like for people who are here from Washington, D.C. to stand up, and we'll all give you a cheer. Anybody here from Washington, D.C.? Nobody here from Washington, And I think there are some people here from Charlottesville. Anybody here from Charlottesville? Stand up. Anybody here from Virginia Beach? Or down in that part of the state? Nobody here right now? Okay, anybody here from Richmond? I'm sure there are people here from Richmond. And what about people from Centerville, Chantilly, Reston, that corner of the county? And people here from Annandale. That's got to be people here from Annandale, yay? Okay. And people here from Arlington and Alexandria, stand up. And maybe the Falls Church people stand up. Anybody here from Falls Church? Yay. And let's say everybody who favors comprehensive, just immigration reform, would you stand up, please? Thank you very much. We represent such wonderful diversity and wonderful opportunities as we go into this new season. So we hope that some of the dreams that we've heard talked about will happen. Thank you very much.
Thank you, Alice. Let's give a warm hand again for Alice. Yeah. That was nice. All right, we're going to continue and move on to our next panel. My suggestion would be, if you have to go to the restroom during the different worship, please go ahead and do that, and or come back, go outside and stretch your legs if you need to, as we keep moving the program along. But before we continue, also, since the interpreters are here, I want to thank Maria Paz del Rio, who's providing simultaneous interpretation, and these are volunteer services. Maria Paz del Rio, raise your hand. Is she here? All right, so maybe her company, but let's give them a warm hand also for the simultaneous translation. Thank you. Gracias. Okay, I'd like to call up here the next panel, Marco Grimaldo, Matthew Porling, and Cindy Daly, please, as I introduce them here. So I'd like to get our next panel going. The moderator will be Marco. This will be a plenary session. Let me just give you a quick introduction about Marco, and then the panelists who are here again. We want Matthew Porling and Cindy Daly. If they're here, we would like you to come up. Please make your way over to the panelists' table. As Marco comes up, he is the CEO and president of the Virginia Interfaith Center for Public Policy. With more than 20 years of experience in the field of politics and nonprofit advocacy, his career has been characterized by a call to public service, working in both church and community. He has sought to help people care for one another and change public policy to help those most in need. In his role at the Virginia Interfaith Center for Public Policy, he and his colleague work toward a vision of a world where people of all faiths cooperate to create compassionate communities that are just, peaceful, equitable, and sustainable. Mr. Grimaldo studied political science at Southwest Texas State University, attended a graduate school at the Georgetown University Public Policy Institute. Let's give a warm hand for Marco Grimaldo. Marco, come up. Let me just move on here as Marco will introduce the next panelist. Today I was supposed to be in California, but the trip was canceled, so here we are being part of this wonderful event. Marco.
Thank you very much, Walter. I really appreciate the opportunity to be here to speak with you about this very important topic. I want to, however, as we move through the morning, I think we've really been privileged to have a lot of our community leaders here present with us. Walter, you are certainly part of that contingent. I think we also have William Watts, who just arrived. And would you stand and be recognized, please? Thank you for joining us. I think we really do benefit when we come together as a community, a diverse community of people concerned about immigrant rights in Virginia. Our next panel discussion really is taking on one of the top issues of concern to Virginia and to immigrants in Virginia as well, and that has to do with health care and the Affordable Care Act. I want to welcome our panelists to come forward to the table. I want to first welcome Massey Worley, and I'll give you his introduction in a moment, but come on up, Massey. And also Cindy Daly with Northern Virginia Family Services. Come on up and take a seat. I think we have the appropriate. Sorry for the costume change. Let me introduce Massey first, and he's going to give us a short talk introducing us to the subject of the Affordable Care Act, including both the marketplace and the Medicaid expansion conversation. And then we'll introduce Cindy at greater length. Massey Worley is Senior Policy Analyst for the Commonwealth Institute for Fiscal Analysis, where he conducts research related to healthcare policy. Prior to joining the Commonwealth Institute, Massey worked for Virginia's Joint Legislative Audit and Review Commission. That's the General Assembly's Program Evaluation Agency. Massey has a bachelor's degree in public policy from the College of William and Mary. He also earned a master's in public policy from the College of William and Mary's Thomas Jefferson Program in Public Policy, where he was a Schroeder Fellow in Health Policy. So we are pleased to have Massey with us. We will ask him to sort of take us through that overview of sort of the Affordable Care Act in Virginia, in particular, breaking out those two important sections, the marketplace and Medicaid. Massey?
Thank you very much, Marco.
You want to come up here?
Can you all hear this? Yeah. All right, well, let's try it. How about now? Is this better? Great. Good morning, and thank you all for being here to talk about this really important topic. The Affordable Care Act, as you all know, is a highly talked about topic, and so I would just like to walk you through the two major ways that this is going to impact Virginia. So the Affordable Care Act has laid out two paths to expand coverage for people all across the country. There is Medicaid expansion, and then the rollout of the new marketplaces. So how does this relate to our communities? There are significant components of the Affordable Care Act that interact with our communities in very distinct ways. One of the most interesting things that I find is that 89% of children in immigrant families are citizens. However, there is significant mixed status within those family units, and that interacts with these new expansions of coverage in very interesting ways. So first, let's talk about Medicaid expansion and where Virginia stands on that. First and foremost, Virginia has not expanded Medicaid yet. I will say that again. Virginia has not expanded Medicaid yet. It is our hope that we will continue to push forward with this so that we can provide coverage to nearly 400,000 uninsured Virginians through this vital program. Current eligibility for Medicaid in Virginia is very meager. Okay? For children and women that are pregnant, they may qualify up to 133% of the federal poverty level for Medicaid. For people that have children but are not pregnant, they may qualify for Medicaid if they make less than 30% of the federal poverty level. For some perspective, 30% of the federal poverty level for a family of 3 is about $6,000 a year. Very low levels. And finally, if you are an adult that does not have children, you are not eligible for Medicaid at all, unless you are aged, blind, or disabled. So what we have is a system, a safety net system, that has very, very low thresholds. Through the Affordable Care Act, we have the opportunity to expand Medicaid to 138% of the federal poverty line for all groups of people, That would be for children, families, women, husbands, uncles, cousins. Everyone would be lifted up to 138%. However, because we have not done that, we've created a coverage gap. And by that I mean, people that qualify under the current eligibility thresholds will continue to be eligible for Medicaid. The other significant component of expansion through the new marketplaces does not kick in until 100% of the federal poverty limit. So what we have are several 100,000 Virginians who will fall into this coverage gap because we have not expanded Medicaid. I should note, as it relates to our communities, there are several key factors that we should keep in mind with relation to immigration status. For immigrants that came to the United States after August 22nd, 1996, there is a 5-year bar placed on Medicaid eligibility. That means that once you've been here, you have had to have a qualified immigration status for 5 years. Virginia actually makes it even tougher than that. There is also a 10-year work requirement, whereby you have to demonstrate that you have been employed legally and appropriately for 10 years. And then, if you fall on hard times, and I mean very hard times, you may qualify for Medicaid. There are some exceptions to our current Medicaid eligibility for refugees, trafficking survivors, veterans, and military families, but those are few and far between. One of the huge victories that we have had in Virginia in recent years was expanding coverage for pregnant women and children who are lawfully present to be eligible for Medicaid and FAMUS. Medicaid, as I mentioned, goes up to 133% for children and pregnant women. FAMUS allows us to go up to 200%. So we have made strides in providing coverage for pregnant women and children. However, we still have a significant number of people who are being left out. And I can promise you that is not good for families. That is not good for employers. Okay? So, as we've talked about the gap, I would like to give some more definition to the other end of that gap, and that is the marketplace. Okay? So, this has been a very big week for a lot of people. I know my friends that are working in health policy, we're just kind of happy to take a breath today, I think. But, so on October 1, the marketplace opened all across the country. And there are a variety of marketplaces. Virginia, our policymakers decided to have a federally facilitated marketplace. There was a significant debate as to whether or not we would have a federally facilitated marketplace, which means it is run by the federal government, or a state-based marketplace where we would have much more control and local resources. We have a federally facilitated marketplace. It is up and running, and it will get up to speed, okay? So as I mentioned, it opened on Tuesday, October 1st. We are just a couple days in. We're starting to hear a few success stories of people getting enrolled for coverage. Now, what types of coverage are available? Coming through the Affordable Care Act, all plans through the marketplace must cover 10 comprehensive essential health benefits. That means that maternity services can no longer be denied. Okay? A wide variety of services that we all need will be covered. There are also in the marketplace a number of tiers of metal. They're called metal tiers. There's bronze and silver and gold and platinum. I think there's some self-explanatory nature to those concepts, but bronze costs less out of pocket. But when you use it for care, you may experience higher out-of-pocket costs. Platinum is pricier, but when you go to use care, there's a lot more coverage. Those kinds of decisions are tough, and I'm going to turn to Cindy in a few minutes to have her discuss how those tough decisions can be facilitated, not told for you, but assisted through resources that we are trying to develop in the state. Also, as a component of the Affordable Care Act, everyone, I'll qualify that in a second, but everyone can get coverage through the marketplace. They cannot be denied due to a pre-existing condition. Some people used to go to the private market, and if they had significant health issues, they could be denied, or they could just be priced out of the market. That cannot happen anymore. The way that the policies and the plans are priced on the new marketplace are based on just a few key factors. They are based on sex. They are no longer based on sex. They are based on age, whether or not you use tobacco products, and where you live. So it used to be that my wife and I would pay drastically different premiums because my wife is a woman and I am a man. That is no longer the case. People of the same age, of different sexes, will pay the same rates. Okay? The other major component to the marketplace is the premium tax credits that are available to help make this coverage affordable. For citizens, tax credits are available between 100 and 400% of the federal poverty line. Those premium tax credits are on a sliding scale. For people that are very near 100%, they are expected to only pay a few percentage points of their income on health insurance. The rest will be covered by premium tax credits. For those individuals who make more, closer to the 400% of the federal poverty line, they will be expected to chip in a bigger amount. So when you go through the marketplace, you enter some key income data that allows the system to calculate exactly how large of a tax credit you are eligible for. And then you can take that credit and you can go shop on the marketplace. And there was some recent research that shows individuals that are below 175% of the federal poverty line will actually have a large enough credit that they can go and get a plan for no premium. I'll say that again. If people are below 175% of the federal poverty line, they can find a plan that does not cost them a monthly premium. They will be expected, when they go to the doctor, to pay their copay, but they will have access to comprehensive, affordable health coverage. I mentioned that the premium tax credits are available from 100 to 400% of the federal poverty line for citizens. For lawfully present immigrants, the situation is actually different. In an interesting way, because of the history of this, they actually are in a better position in many ways. As you may recall, the Affordable Care Act was structured in a way that Medicaid expansion was not initially a choice left up to the states. It was a part of the law that all states would draw down the federal funds and expand Medicaid. However, as the Affordable Care Act processed through the Supreme Court last year, it was ruled that Medicaid expansion had to be a state option. So, what was built into the premium tax credits was that lawfully present immigrants who cannot qualify for Medicaid because of their immigration status can get premium tax credits from 0 to 400% of the federal poverty line, whereas citizens were all expected to be routed to Medicaid because the program was going to be expanded everywhere. Medicaid expansion became an option, creating a coverage gap. So we have a coverage gap for citizens, but it is really important to remember that people in our communities who cannot qualify for Medicaid can go to the marketplace, and they can get assistance through the marketplace. So, I know that this is an issue that has many, many details. And I mentioned that our decision, that the policymakers' decision to have a federally facilitated marketplace limited the resources available to help connect consumers with coverage. There are grants that came down, totaling about $1.7 million, that went to what are called the federal navigators. These are individuals who have received significant training to help connect consumers to coverage through the marketplace. These groups are primarily located around the state through the legal aid groups. They have about 15 people that are designated to help. 15 people. That sounds, I'm glad there are 15 people, right? There are 15 navigators. I should be very clear that there are 624,000 Virginians who are eligible for premium tax credits in Virginia. So when you think about 15 navigators connecting 624,000 people with coverage, many of them who do not have insurance, do not understand how this process works, there is a huge need for additional helpers. Just look for the helpers, right? But that is where we've had other groups come in. The federally qualified health centers have received some funding, and they will have, not navigators, they will have in-person assisters available at many of their locations. Okay? So those are your local FQHCs. Then there are other groups whose mission it is to help with this, to help implement the Affordable Care Act, to help connect consumers to coverage. And those are groups that are often called certified application counselors. They're also champions for coverage. The certified application counselors are groups that have been certified by the federal government to help people connect with coverage, and they have a body of volunteers and some employees who have gone through the appropriate training to facilitate the process. So with that, I'm going to hand over to Cindy Daly from Northern Virginia Family Services. Actually, I'm going to hand it to Marcos to introduce Cindy. But her whole conversation should really be about how we are going to step up, how we are going to rise above this decision to have a federally facilitated marketplace to deploy more resources and get coverage for people who deserve it, who need it, and who can afford it. So, Marcos.
Thank you, Matthew. I really appreciate your guidance on this. So I should probably offer full disclosure. The Virginia Interfaith Center for Public Policy is pleased to convene Virginia Consumer Voices for Healthcare. Massey Worley and the Commonwealth Institute serve on that leadership team. And Northern Virginia Family Services is one of our critical partners in the Northern Virginia area. So we do have a bit of an agenda to share with you here. Allow me now to introduce Cindy Daly. Cindy is Director of Health and Mental Health Programs for Northern Virginia Family Services. Cindy has spent more than 33 years working in the human services field within the international, military, county, and nonprofit sectors. With almost 25 years at Northern Virginia Family Services, Cindy has held various positions, including the Director of Multicultural Human Services, Director of Quality Improvement, Program Manager for the Counseling Services, and Special Foster Care Manager, Case Manager, and Trainer. Using her skills to manage new initiatives, Cindy has taken on a leadership role in shaping a collaborative strategy to assist Northern Virginia consumers and small businesses to better understand and enroll in the Affordable Care Act marketplace. We are honored to have Cindy talk with us, and I'll invite you to come up to the microphone, please.
pleasure to be here with you all today. As Massey alluded to, this is a really complex reform that we're going through, and we have to figure out how to share this information and get information out to the folks in our community who need it the most. When he talked about the fact that we have the 15 people in Virginia, compare that to Maryland, who's a state-based exchange, and they just hired 300 people to do the same work, and their numbers of uninsured are probably lower, I would venture to guess. So that's some of the difference in what we're encountering as we try to roll out this reform. So Northern Virginia Family Service had, as the RFP came out for the Navigator grant, we had also applied for it, and doing so had built a consortium of partners across Northern Virginia because we are represented throughout all of Northern Virginia. So we pulled county, faith-based, private, our ethnic minority organizations together to say, how can we all work together to make sure, because no one entity is going to be able to reach everybody. So when the proposal was awarded and we were not the recipient, we pulled everybody back together and said, you know what, we still need to do this. We need to figure out, as a consortium across this community that really cares about and wants to make sure that our citizens have access to insurance, that we need to figure a way out. So with support from Virginia Consumer Voices for Healthcare, as well as Northern Virginia Health Foundation, we have gotten some local funding to be able to try to put a strategy in place to do more outreach and education and enrollment assistance with the community members. So what we're doing is Northern Virginia Family Service is trying to embark on a volunteer effort. So this is where you all can come in and assist us. We have been doing some volunteer information sessions and are going to continue to do that to be able to not only bring on board folks that may be interested in being community mobilizers, is what we're calling them, people that want to go out and just help us get the word out. There's not going to be a high level of sophisticated training. You may come to us and say, you know, I could interpret, but I can't do the materials. You could be a community mobilizer. There's lots of fairs going on. I saw the sign coming through Annandale about the fair here in October. The Fall Fairfax Fest is out going on Saturday. So, being able to staff a table, having extra bodies to help hand out pamphlets and information. So that's one way folks can work with our efforts. The second is a speakers bureau. There is a lot of information that needs to get out. Matthew touched on a little bit of it. There are lots of little details that we need people to be able to understand, and it's not going to happen just in one conversation. I've probably been to 15 trainings, and each time I go, I get a slightly different or new piece about what this law means and how it's going to affect people and what they need to do to get ready and the pieces of paper they need to have to make it happen. So we are going to need speakers. We're going to need people to go out and be able to talk to their communities. These could be communities of faith, they could be in a community center, they could be a sewing circle, they could be wherever folks gather. So we do need folks that can help us either translate the information that those of us that have been getting the training can do, or to be able to come and get trained. And then the last category is, as Massey mentioned, the certified application counselors. This is, we have probably about 10 or 12 organizations now across Northern Virginia that we've been working with to actually get designated as an organization. The training is online. You can actually look at it now, you just can't actually take it because you have to have a number to get in to actually take the training. But the slides are up there. So we're encouraging people to start looking now. But you can actually come, we'll get you registered, we have to do a background check, we have to do some discussion training about confidentiality and protecting of people's private information. But you can become a certified application counselor that will help you sit down with folks and actually help them think through and give them factual information about their choices. You won't be making the choice for them. The goal of both navigators and certified application counselors is that we're helping them make informed choices, and it's their choice, but we need to make sure they have all the information. So those are the various ways that folks can participate in this initiative across our community. We have a lot of the partners are here today, and you're going to be hearing from Yvette, who's sitting right in front of me, with Jessica, with the Navigator group, and they'll be talking with you this afternoon as well. So we're all trying to collaborate and work together so that we have a few resources. We don't want to be redundant and repetitive, and so we want to make sure that we've got a strategy that helps to reach deep into our communities. So if you're interested, I'm going to give you an email address. It's health-help@nvfs.org. I'll say that again. So health-help, and then it's the initials of our organization. So it's at nvfs.org. So that's one way you can contact us. We are doing volunteer information fairs, and the next one will be on October 15th at 6:30 at our Arlington Boulevard office, which is in the BB&T building up at Seven Corners and Route 50, and that's 6400. And I will make an effort to make sure that when we get the flyer updated, that we get that sent out through the same mechanisms that announced the forum. Dan Choi can help me out with that, I'm sure. I think that's all I need to say right now. We are looking for partners, we are looking for volunteers, and we are looking for opportunities. So if you have something, someplace in mind that we can come and deploy our volunteers, you can use that email address as well, because it's a two-way street. You may have places for us to send volunteers, or you may want to be a volunteer to help us. Thank you.
Cindy, I wonder if we could ask, are there any of the groups that are volunteering with NVFS already in the room? Are there people that are already engaged in some of this work? Are you aware of folks that are here?
Well, I know Yvette has been partnering.
Let's stand up and be recognized. You'll be part of a workshop this afternoon. And so folks who really do want to delve more deeply into the marketplace conversation, that will be an important opportunity this afternoon.
We have done some work with both BPSOS.
Please stand and be recognized and tell BPSOS is.
Yeah, both people SOS.
Got it. So that will be a really important opportunity this afternoon. I thought this would be an important time for us to be able to pose some of our questions to the panel. I'm going to put one out there for them to start with, and then as you think about your questions, you can raise your hands and we'll call on you. So the first question I had was sort of for both of you to answer a different perspective on Medicaid, and in particular, when we think about who qualifies for Medicaid currently, right, that 30% of the poverty line, I'm not sure quite what that means necessarily in dollars. I also don't have a sense of what that means in terms of family and how you characterize that, so maybe you might both speak to that just a little bit, and then we'll start taking questions from the audience.
How about now? Ooh, yay! Those tricky buttons. Okay. So, Marco, if I understand your question correctly, first is some perspective on what it means that parents can qualify for Medicaid if their income is less than 30% of the federal poverty line. For a family of three, the 30% of the federal poverty line is about $6,000 a year. Not a month, $6,000 a year. Okay? So I know I've spent some time living in Northern Virginia, And this area is incredibly expensive. And if you're trying to make ends meet on $6,000 a year, you are truly, truly struggling. And so in Virginia, because we have not expanded Medicaid, individuals and families, a family of 3 that makes more than $6,000 will not have coverage options available to them until they make significantly more than that. Okay? So as I mentioned earlier, we estimate that approximately 250,000 Virginians who are currently uninsured will not have access to quality, affordable coverage because they will fall into that gap.
So from the community perspective, we are not 100% sure where the dividing line is going to be. We've got a call from some of the Post reporters who've asked, we want to interview a family that falls into the Medicaid coverage gap. Well, we haven't really, because we're just getting started thinking about who fits in the into the marketplace. It's going to be once they enroll in the marketplace and we look at how that gets calculated, where they will actually fall, whether it's in the Medicaid gap or whether they're actually going to be able to qualify for that, because the 100 to 400% could potentially, as Massey mentioned, qualify and end up with a 0 premium. So we haven't actually discerned person by person where that's going to fall out. What we're trying to make sure, though, is that when we do find those folks, is that we maintain some kind of contact information. And that's going to be true for all of you who are working with folks, because once it does pass, and we do get it, we're going to want to reach out and be able to gather those folks back in so that we can get them told.
You know, one of the things that I heard from Cindy was there is a distinct individual component to this. We talk about family income because that largely guides eligibility. But within our communities, and within our families, there are a number of significant components that impact eligibility. So if in the family of 3, there is a husband and a wife and a child, and let's say that they make $8,000 a year. So the parents don't qualify for Medicaid. But the child will qualify for Medicaid. And let's say that the husband is a lawfully present immigrant. He can go buy coverage on the marketplace. Because remember, the premium tax credits are available for lawfully present immigrants from 0 to 400%. And then let's say that the mother is a citizen, making $8,000 a year. She will be the only person in her family who is not eligible for affordable coverage. So I hope that gives some context to the kind of unfortunate situations, the dynamics that we will be running into as we proceed to getting people coverage. It is going to be a family view, but it is also going to be a distinctly individual view. And there are going to be a lot of really sad stories. And I hope that groups that are directly working with people, please take those stories down. Keep in touch with those people. Because it is vitally important that we have those stories so that we can lift those stories up as very relevant pieces of the conversation that we are having with our elected officials about why we need to move forward with Medicaid expansion.
Thank you, Massey. I know that we've got microphones on either side of the room, so if you have a question you'd like to ask, raise your hand and we'll try and get a microphone to you. I'll take questions from people who have the microphones. Maybe we can distribute it. I see a question over here, and if we could share a microphone with one of these gentlemen, that would be great. Ma'am, would you stand up?
Buenos días, mi nombre es Ingrid Vaca y pertenezco a la Organización de Familias Unidas. ellos pueden aplicar a este servicio de salud o pueden también, son aplicables para Medicaid.
Muchas gracias por su pregunta. The question is whether or not Dreamers would be able to apply for health care coverage under either one of these two programs that we've talked about, and to what extent that might move forward. If either of you could answer that question.
Unfortunately, Dreamers is one of the categories that is not going to be covered under the Act. And I don't know if there are any efforts afoot. That was something that happened after the Affordable Care Act went into law.
So we have a question here at this microphone. If you'll continue to raise your hands, we'll try and get a microphone to you, and I'll take questions from the microphones. Yes, sir.
This question is for Massey. You spoke of a family of 3, and I was wondering, is a single parent with 2 children a family of 3, and do the same numbers apply?
Yes, thank you. That is a great question. So my situation was a hypothetical, but in terms of the family size, a family of 3 is a family of 3 is a family of 3 for determining that. I will stress, though, that there are different calculations for determining eligibility for Medicaid versus the marketplace. But and there are a lot of things that define what a family is and who is considered in the household. But yes, so it is for the marketplace specifically. That is now based on a taxable concept of Magi, and we've moved towards that with Medicaid as well. And so it is based on who is by tax purposes in your household and the number of dependents that you claim.
Do you have a question over here?
Could you define legally present? Does it include holders of TPS?
Yes,
Yes, it does. The same document. The National Immigration Law Center has put out an excellent document along with a whole checklist of documents that folks might present that would give lawful present. So lawfully present is a much more expanded category than the definitions that are used for Medicaid. So it is much more expansive. It's pretty much even visas, folks that have visas are eligible to apply under the marketplace. It's really the dreamers that got left out.
Thanks, really. Yes, ma'am, in the center.
Hi, sort of a two-part question, 2 questions, one for Cindy, the other one I'm not sure. Can you connect me to the organization or coalition in Central Virginia, Richmond, that is doing the kind of work that you're doing to put together speakers, etc.? The other one is, typically organizations that are doing service don't do as much advocacy and vice versa, so is a coalition coming together to work at this commission that is going to be anti-expanding Medicaid that we've got to work on?
So your first question, in terms of the Richmond area, Kathy May, you want to raise your hand, Kathy, back here in the back, with Virginia Consumer Voices for Children. They have a person in each region across Virginia that they can help connect you with to get speakers on board.
So your question about Medicaid Innovation Reform Commission is an important one. There is a flyer that's at the table that also includes, I think I'm correct, because I hoped that there would be there. It also includes the names of the members on that commission. And we encourage people who have an interest in expanding Medicaid in Virginia to be in contact with the commission. MIRC is their acronym, MERC. And if you were to just Google Virginia MERC, you would easily find their website where you can add comments. So now is an important time between now especially and October 15th, when they will be taking public comments. For many of you who might have an interest in coming to Richmond to offer public comments, that'll be a a very busy day on October 15th when they take public comments from both pro and con, persons in favor of expanding Medicaid and folks opposed. But that's coming up as well. Please visit the table and we'll be glad to provide you with further information.
I'll also add that there is, so there's VCV, there's Virginia Organizing, and then there's also a coalition called HAB, which is Healthcare for All Virginians, that has largely been working on Medicaid expansion as their principal legislative advocacy effort. And so...
Repeat the name.
Yeah, and that's a fair point because Virginia New Majority is in the room and they've been doing a lot of work in Northern Virginia trying to help people become, sort of more outspoken or speak to the issue more actively, so that's important as well. Do we have another question from the audience? Yes, ma'am, go ahead.
Hi, good morning. We understand that only lawfully present immigrants will be eligible to participate in the marketplaces, but for those who do not qualify, such as DACA eligible folks, is there still a private option for those who may want to? Okay, so no insurance at all.
You're talking about the PCIC?
I don't know.
So I think there's two questions that I heard there. One is there a private option? Can they purchase insurance on the open marketplace? Yes, they could.
Okay.
Could they purchase insurance and get a tax break? No.
Okay, but there's still a more rather expensive option, but there is still an option then.
And I think the one opportunity that might be there for dreamers, and I don't want to speak out of turn, so I'll ask our panel if this is correct. If they're in school and qualify to purchase insurance at their university, that would be a different option for them that is at least a little bit of an extension if they're in school and can get insurance that way.
All right, I was using dreamers as an example just because they might have the income available to actually buy insurance. But as far as anyone else, there will still be some other tax credit-free option.
No, there would be another option on the market, out of the marketplace. So the products that are in the marketplace and the products that are out of the marketplace fall under a lot of the same requirements of the Affordable Care Act. So those 10 essential benefits, no pre-existing conditions, lifetime caps, those kinds of things. But they're not eligible for any kind of a tax credit.
Thank you.
Yes,
could you explain what the commission, how will it get expanded? Does it need a work by the legislature, signed by the governor, or I don't quite understand the commission. How will it get expanded?
That's a great question. How will it actually happen? I think it's a fantastic question. So for a little bit of background, I think there's been a reference to the MERC, which is the Medicaid Innovation and Reform Commission. And that commission was established through budget language and code in the 2013 General Assembly. And essentially what it laid out was a series of 3 phases of reforms. And the 10 voting members of the MERC, 5 from the House and 5 from the Senate, are charged with overseeing these reforms. And it is their charge to vote when the conditions of the reforms have been met to expand Medicaid. Now, just logistically, they have met twice. They were charged by code to meet every 2 months. So they met in June and in August, and they're meeting again in October, and they're providing an excellent opportunity for public comment. They're meeting on October 15th to receive public comment, and then again on the 21st to proceed with their business of overseeing the phases of reforms. Something very significant happens just a couple weeks after that meeting, though. Anybody know what happens just a few weeks after October 21st? There's an election. Okay. And in Virginia, we have one-term governors. So that means we are most certainly going to have a new governor. And we will also have new members of the House of Delegates. Many of them will be returning, but there will be some new members. And then in just a few short weeks, we will have a new General Assembly session. And as a part of that session, it is almost certain that regardless of who wins the gubernatorial election, this issue will be revisited. So I understand that you're a bit confused about how this process will lead to expansion. It is relatively unclear. As it stands now, they will meet in October and then again in December, and then we'll roll into the session.